Tonight we welcome Ellis Medicine, founded in 1885 under the name of Schenectady Free Dispensary, which was located at 408 Union Street. Ellis Medicine is a Schenectady institution which at one time included a 3-year nursing program located right here in City Hall. According to the American Hospital Association, our nation's hospitals employ 5.3 million people, represent the second largest source of private sector employment, spend approximately $320 billion on goods and services from other businesses, and account for nearly $2 trillion in economic activity. Today, Ellis Medicine is a 438-bed community and teaching healthcare system, serving New York's capital region with 4 campuses, including Ellis Hospital, Ellis Health Center, Bellevue Women's Center, and the Medical Center of Clifton Park, plus 5 additional service locations. With more than 3,300 employees and more than 700 members on the medical staff, Ellis Medicine provides a lifetime of care for patients. According to a press release issued by Ellis Medicine, dated January 31st, 2014, 4 Ellis Medicine primary care practices have received national recognition for their patient-centered, coordinated model of care. Ellis primary care offices in Clifton Park, Glenville, and Schenectady, both McClellan and Knott Street locations, have earned Level 3 patient-centered medical home status, which is the highest status achievable by the National Committee for Quality Assurance. In the same press release, Ellis President and CEO James Connolly said, "In this age of healthcare reform, it's imperative that providers and patients work more closely than ever before to ensure the highest quality and most cost-effective care possible." With us tonight, representing Ellis Medicine, is Paul Milton, Executive Vice President and Chief Operations Officer for Ellis Medicine. Please join me in welcoming Mr. Milton on behalf of Ellis Medicine. Thank you for being here.
Thank you. So thank you for having me. As you said, I'm Paul Milton. I'm the Chief Operating Officer at Ellis. I have 10 minutes to go through roughly 14 slides, so I'll be quick. I'll give you a sense of the economic impact to the city of Schenectady and a little bit to the surrounding area. Jesse's going to help me here with the slide. So let's go to the next slide. You go to the next one. So this is gives you a sense of how long Ellis has been here. Ellis has been around for 130 years thereabouts. And you can see our second hospital was actually where we are right now, from 1893 to 1906. This picture here represents where Ellis Hospital was, and since then we've been up on the Knott Street campus. Next slide. So we do operate as 4 campuses, as you can see. The upper left there, that's Bellevue. Upper right is the Ellis Health Center McClellan campus. Lower left is our site up in Clifton Park, and then the main picture there, as you see where we are in the city of Schenectady. That's our main campus. That's where most of the employees are, and that's where most of the patient care is taken care of. Next slide. This gives you an idea of our primary care service area. When we do a survey to see of where most of the patients come from, could be many of you in this room, you can see most of them come from the center of Schenectady. So that's primary, our primary service area and the folks that we take care of. Go to the next slide. What we do, what Ellis does for the city of Schenectady, you've mentioned a couple, I think, of the key points here. There is a value metric that the state of New York puts on hospitals, and we scored very well. In fact, we were the 7th best value in the state of New York that looks at quality metrics and cost metrics. As measured by our own business, we're a $370 million organization. Our average employee is in the range of about $75,000 to $80,000 as their compensation and benefit package. We do pay a significant amount of taxes in the community. I have a slide that comes up that'll show you that. It's over $100 million, or $100,000, excuse me. And we provide $4 million worth of uncompensated care or charity care to the community, and roughly $5 million on what we call lost care for Medicare, and about $6 million on sort of unreimbursed or lost care for Medicaid patients. We do a lot of free care in the community in addition to a number of screenings for example, flu shots that we provide. And we're also training the next generation of caregivers. We have the Belanger School of Nursing and our residency program for family medicine. So we're trying to build for the next generation to take care of all of us in this community. The next slide. Give you a feel for the care we provide to the residents of Schenectady. You can see we have 2 ERs in Schenectady here, one on McClellan Street and one on Knott Street. 58,000 or 82% of the visits into those ERs come directly from Schenectady. And of all of our inpatient care, you can see roughly 65% of all of our admissions, or almost 11,700 admissions, are from Schenectady City residents. I do think it's an important point to make a note here that as you can see in the inpatient care, roughly about 36% then of people from outside this community come into Schenectady for care. Go next slide. So why do patients come to Ellis? A little bit has to do with, or a significant amount has to do with the value statement that I made earlier. We are a very good value, and you can see up here in the slides that our services for stroke patients, for bariatric patients, for cardiac patients, and neuro patients rank as some of the highest in the state of New York. So in terms of providing great quality value and cost value, we continue to provide good value to the people in this community. We were pleased last year by the Chamber to receive the Corporation of the Year. So we've had a busy 5 years, as maybe many of you know, in putting things together for the Ellis system. So we're pleased to be recognized by our colleagues in the community to receive that award. Next slide. Haney's, which is the Hospital Association of New York, which is our state association, puts this information together for us. So this is the direct and the indirect economic impact for the city. So you can see all told here, and this would include not only our business, but what I call the spin-off business. So if I go down the street to a small business here and buy pizza or buy something, there's a significant spin-off effect. So roughly we have spun off, including our own, 5,000 plus jobs and over $600 million into this community. And you can see the taxes that are paid, income and sales taxes, are $38 million federal, $21 million for the state, and then $8 million locally here. So a very significant impact to the city and this community. Next slide. This is our direct impact here as one of the largest employers in the area and in the city. We employ over 3,300 people, and you can see many of them, more than almost 56% of them, are residents of Schenectady. And as I said, the average payroll and benefit package for the average person is about $75,000. So a significant impact that we provide to the city for that. Next slide. And I talked about the taxes that we pay. We rent a number of private space in the community, mostly for physician office practices. And you can see the taxes we pay as a result of that total $175,000. Much of that is on the McClellan Street campus over at the Ellis Health Center in the Cushing building there. Next slide. There's been a lot going on in the community, particularly since we merged the 3 hospitals. And so as healthcare changes, we're working a lot with the communities that are in the city, probably more so than we ever had in the past. I won't go through each one of these in the interest of time, but I think you can see, I know in the last year, our collaboration with Hometown Health to absorb the free clinic, the Schenectady Free Clinic, was important. We've done a You Matter survey to reach out to some of the residents in the community that are most in need, and so we're providing our services directly sort of building our strategy based on the results of the You Matter survey, so that we can be sort of ahead of all the changes going on within healthcare. We want Ellis and we want Schenectady to be on the forefront and be innovative with all the changes going on in healthcare. And we couldn't do it without all the other providers in the community right now. And we're blessed in this community to have so many other partners to work with. Next slide. Future plans. As I mentioned, healthcare is a very dynamic field right now. Our consolidation of all the services amongst the different campuses. The Knott Street campus here in Schenectady has one of the biggest impacts you can see here with the development of the emergency department. So we will consolidate services there by the end of this year and then convert the emergency room on the McClellan Street campus more to an urgent care type campus. This fulfills all of the requirements of the Berger Commission that started over 6 years ago from now. You can see in terms of staying modern, we're upgrading our operating room facilities, have invested a fair amount of money and educated staff regarding robotic surgery, and over on the McClellan campus have made a significant investment for dental care for our pediatric residents in the community. As I mentioned, this all is important to do by having some expansion outside just the core of the city of Schenectady. So some of our alliances, our own is the Medical Center of Clifton Park, which actually pulls on many of the residents in the southern Saratoga County and brings them down to Schenectady for services to the main hospital. And we are looking at alliances with other healthcare organizations in the greater capital region as healthcare changes to align with other providers yet to be named in the future. But this gives you an idea about sort of the significant things that are going to be going on over the next year. The ER was a big investment for us, $61 million, and you can see a number of construction jobs that were created as part of that, 150 construction jobs in this community. The next slide. I talked about the importance of the future and training the next sort of round of talent. And so we have a family medicine residency program, an osteopathic residency program, and a dental residency program, and fellowships in OBGYN. As you can see here, we've had 40 graduates since 2006 who we've trained as family medicine physicians who have decided to stay in this community. There is a national shortage of family medicine physicians, so we're blessed to have this training program, and we try very hard to keep these very well-trained physicians in this community to take care of all of us. In addition to the School of Nursing, the Belanger School of Nursing, which we have moved up to the McClellan Street campus, we have a very high pass rate for these students. And as you can see, about 50 graduates a year stay in this community and take jobs within Ellis. Many of them stay with Ellis. Many of them we try to work with our partners so they stay in the community here. And next slide. So that's it. I hope I stayed till roughly my 10 minutes. We're here. We've been here for 130 years, and I foresee us being here for a long time to come with all the changes going on in healthcare. So I thank you for your time, and hopefully it gives you an idea of the economic impact that Ellis brings to this city.
Yes, and we're glad you're here too. So,
thank you.
Thank you.